The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back, Shifties, to the Shift podcast. I have an incredibly special guest today, Dr. Bob Dent. He and I are going to talk a lot about Bob's mental health journey. He's very transparent. He's going to tell his great story. We're going to talk about Bob's shifts during his incredible career. And then Bob and I are just going to go back and forth and talk about how important it is to name it, claim it, tame it. And we'll talk about name it, claim it, tame it a little bit into the podcast. So Dr. Bob Dent, thank you so much for joining me and being a guest. A little story. I kind of stalked Bob. About 4 years ago, I approached him at a magnet conference. He probably doesn't even remember. Then about 3 years ago, I saw him at another magnet conference at a breakfast. And then finally, we connected after I listened to him speak at the most recent magnet conference. And then he and I just decided that we're able, we believe, to create some greatness and really help continue support nurses on their mental health journey and on their well-being journey. So Dr. Dent, take it away.
Well, thank you. I appreciate the opportunity to be here. And, as far as the opportunity and the connection with you, it was great, to have that breakfast that day and then to be able to follow up at this last Magnet and Pathway conference. And so here you're wanting me to share a little bit about my mental health journey, right?
That's right. And it's a great story. And I want to say this real quick, Bob, for our shifties that are listening, some of the topic, this can be sensitive. So we want to give you a heads up. There might be some sensitive parts to our discussion. So I want to give you a heads up. But Bob, first tell the shifties, where did the shift, or what led to the shift when you recognized that you weren't okay?
Yeah, that's an interesting question and a big part of the journey. For many years, I struggled, suffered, if you will, in silence, and with my own mental health, and so it was a lot of suicidal ideation. And so when we talk about triggers and those kinds of things, if anybody's listening and you need or want, to be able to need support, then make sure you're reaching out for there. But so I had a lot of suicidal ideation, and I didn't know where it was coming from, and and this happened for several years, and not just passive suicidal ideation, but actually active suicide attempts. And so I'm a multiple suicide attempt survivor, and had gone through quite a bit there. But I think it was over that time, and it was the fact that I realized that a lot of my good days, which were long, were now getting shorter, and my bad days were getting longer in there. And it seemed like to me that the suicidal ideation was more frequent in my as I was thinking through that. And so I did, this not many years ago, I guess it was probably 8 or 9 years ago, did reach out to a friend and colleague of mine who happened to be a psychiatrist, and I wanted this to be off the books, and said, hey, I need to visit with you. And part of that, I think, gets into some of the conversation that we might have here about, being able to humanize the story around mental health and suicidal ideation, and decreasing the stigma associated with that. But I was concerned about my career and everything that was going on. So I talked to him. I said, I want this off the books, and can we meet early in the morning? I'm an early riser, and so I would meet with him well before sun up and before people began getting to work, and we talked through some of my mental health struggles and in there. And so that was the first shift that I had. It was the fact that, it was a realization that, my suicidal ideation was not getting any better. In fact, it felt like it was getting worse. I then moved after that, shortly after that time frame, and in the overall passive and active suicidal ideation just continued to get worse in there. And it was probably just a couple of years ago that I talked to my wife. We were sitting in a car, and I said, I don't think I'm not going to live by the end of this year. It was hard. And I think it was, and even in part of that, the months leading into that particular conversation, I opened up to my primary care physician and talked to him, began to see a therapist. This was during the COVID years, and during COVID, everything was virtual, and it was those virtual therapy visits just were not helping me. In fact, there was even active suicide attempts. Even either during or shortly after the therapy visit itself, so it wasn't effective. And I actually had one therapist that told me that, right at about that same time frame, going through my history, that she could not help me. And so, it was hard. It was hard to be able to hear that. I was sitting in the side of my house and visiting with her virtually, and went through my story and where I'd been over the previous years. But she said she could not help me. And I felt like, it was hopeless. There was nothing that can be done for me. I was broken, at that point. And that feeling just was not, what I needed. So I did reach out to my primary care doc after talking to, my wife that night, and then right after that, entered residential treatment. So it was about a month later that I entered residential treatment for about 3 months to receive the help I need. And it was there for the first time that I actually was able to begin labeling things, from emotions to the fact that I was actually diagnosed at that point with major depressive disorder. Never had I ever thought that I had major depression. And we can talk through what that might look like in somebody that's highly functioning with a depression, and how I leaned into that aspect of that with my work. But major depression, and also the ongoing chronic suicidal ideation and suicide attempts. But then right after that, diagnosed with complex post-traumatic stress disorder, or complex PTSD, which I learned as part of this whole journey. In my shift, it was related to my adverse childhood events, and there's an ACEs survey, and my score on my ACE survey is a 9, which the highest of that is 10. And I scored a 9 on that, and to be able to study, I love to study, and so began reading a lot on major depression, chronic suicidality, and complex PTSD, and things began to connect with how I was feeling, what I was doing, the decisions that I was making, which that began that whole shift in what I do in there. So that's a little bit about it, and we can dive in as deep as you want to in here and talk through that as much as you want to, Andrea.
No, I appreciate that. And a couple things that you said, and I mentioned in the beginning, name it, claim it, tame it. I think in the beginning, we're all just trying to name this feeling. And sometimes we just don't know what it is. But once we're able to name it, then we can claim it, that we know something's not right, something's off. And then how do we tame it? And we tame it through whether it's therapy, whether it's support groups. So that's why I mentioned the name it, claim it, tame it. And what's interesting is after I heard you speak and you mentioned the ACE evaluation, I did one myself, and I scored a 5. And, Bob, you and I briefly talked about this a couple days ago. I was at a point probably 15, 16 years ago where I would wake up in the morning and I felt like I couldn't go on. What's the use? Which for me, now that I know this because of my work with burnout at SE Healthcare and just my work in general, I was suffering from burnout. But what I recognized is, and this is the name it part, I had stressors that led to burnout both in my personal and professional life. And it overwhelmed me so much that I had to go to my organization's EAP. I went to a therapist. I was able to name it and claim it and tame it. And I was able to put in some strategies to help mitigate some of this feeling of being overwhelmed. What was happening is I was in school, I had two small children, I had a job, I was married, and I felt like everyone was getting 25%. And that in doing so, I felt like I was letting everyone down. And I was also letting myself down. So it just was this big snowball that led to, I have social anxiety. Mine wasn't diagnosed as depression, but it was social anxiety. And I remember 3 and 4 nights in a row, I could not sleep. I was so anxious because I felt like every time I tried to fall asleep, there was something else I had to do. And I could never thread the needle. I could never close the loop. And I just didn't feel fulfilled. And the shift for me was recognizing a couple of things. I had to get off a night shift. I was a night shift ICU nurse. That was just not healthy for me. And then I had to start taking time to take care of myself and recognizing what was going on. And I remember crying all the way to work. And what I also remember is, gosh, looking back, how did the people I work with not recognize that I was not myself? And that's part of the work that you and I talked about, Bob. It's so important for us as nurses, as people in the healthcare space, to be able to recognize these signs and symptoms in ourselves and the people that we work elbow to elbow with. Because if somebody would have recognized that in me years ago, or if I would have recognized that in myself, I probably could have not had so much suffering along the way. And I don't know if any of my story kind of resonates with your journey, but that's just a little bit of my journey, Bob.
Yeah, and it's and I appreciate you being able to share that today as as well as the other day, and as we talk through that, and each of us are going to be different in there. And I think as a leader, when you're talking about recognizing it, I mean, one, you got to for yourself, but in our where we work and within our families, how do we recognize that? And it's a lot in building those relationships of trust and with your teams, that creating those psychologically safe spaces for people to have those kinds of conversations and be open about it. I mean, the more we talk about mental health and the struggles of people, the more that people can get the help they need, and we can save lives as part of that. As part of that. And so, yes, I think that's an important part of it. And we've got to be present to be able to see those differences. And I talk to my leaders on a regular basis. If Andrea is coming in today and if she's not acting herself, it's not necessarily we don't need to go down the discipline or corrective action process. We need to understand what's going on with Andrea, and be able to to help out where we need to. Occasionally, there may be something that needs to be done from an HR perspective, and recognize that people are dealing with some pretty significant struggles in their personal and professional lives, and to be able to connect with people on that level is a very important part of leadership, in my perspective, in there.
The Shift is brought to you by SE Healthcare. Is burnout costing your organization its best nurses? How do you know? SE Healthcare can help. Our evidence-based approach helps nurse leaders boost retention, enhance job satisfaction, and bring joy back into our great profession. In addition, it helps elevate quality patient care, because when the people taking care of the people are at their best, patients get the care they deserve. We can reduce burnout by an impressive 50%. Are you ready to uncover burnout's impact on your team? Visit sehealthcaresolutions.com, The Shift, for your free assessment today. Bob, so you just reminded me of something. I do something called RISE. It's Reignite, Inspire, Support, Empower. And I work with, do you know Dan Kelly out at Providence?
Name sounds familiar. Yes.
Shout out to Dan Kelly, great man, chief nursing officer of the one of the regions in the Providence Health System. I think he used to work at in Texas. That's why I thought maybe you knew him, Bob. But he and his leadership team, I led this exercise, and everyone had to go around the room and say, when they heard the word leadership, what's the one word only that comes to mind? And I will take this to the grave because it was a powerful moment from Dan Kelly. Shout out to him. Embrace. And what you just said kind of triggered that in my head is, as a leader, it's people first, human centered. And as a leader, you have to embrace people where they are. And I think you just described that so perfect in your leadership style and how you lead your team. Do you think in your work and on your mental health journey, do you think you've contributed to the well-being of some of the people that you lead?
Yes. I've had multiple during COVID, I did create some of those psychological safe spaces and in almost team formats. We would come together in an auditorium and I'd open up and just have that sort of conversation about my own struggles with that from a leadership perspective. And this was interprofessional. It's not just nursing. It was all of our leaders who were going through that. And what we found in there is how many people were struggling through those years in there specifically, and to be able to have that space to open up. And so it wasn't just one session, then we did multiple because it needed that. And I partnered then with our chaplaincy department and we're able to get some help. I had several one-on-one conversations with people as I opened up a little bit more about, going through my mental health journey. And based on that sort of conversation with them, they ended up seeking, therapy themselves and would come back and say, "Hey, Bob, based on, from our conversation, I was able to get therapy and I didn't know how much I needed it. And so thank you for that." And then you had another, colleague of mine, said that, if Bob can talk about it, I can. And I've never talked about it before. And so he began to open up a little bit more. So leaning into that and creating, again, humanizing the story and recognizing that, those struggles that people have, and to be able to create that space to have those types of conversations. So yes, and those are just people here locally, but I've had conversations with colleagues all over the country and even internationally who once I began to share more of my story, who have called me or connected with me to share for the first time, what they're going through, and they said, I've never told anybody this, and here's what's going on. And so I think it's those kinds of things and the connections that we make and creating that space for people to be comfortable speaking up as much as they can.
That's a really good point. I'm kind of smiling because that's really how we connected. As soon as I heard you speak at Magnet Pathway Conference, I immediately felt psychologically safe to have this discussion. And then we started saying, you know what, let's take this on the Shift podcast, because there's a lot of people. And you mentioned to me after you spoke at Magnet Pathway, there was a line that people really wanted to come up. People want to talk about their story. People want to be heard, and they want to feel like they're not alone or isolated in this feeling of every day's not okay. And I think, we also talked about this, Bob. If anyone's interested, Bob and we're going to go on the road, and we want to take this and bring this to organizations. We want to talk about how we can rise. How can we can rise above and reignite people, inspire people, support people, empower people, have people open up and have these discussions, because you don't want to live in silence. And we're really on a journey, I guess, to call it, to remove the stigma. I think that's so important that we remove the stigma. I remember when I went to the EAP, I literally went through a box of tissues. I cried for an entire hour. I didn't want to see people going into that building, because I didn't want people judging. Oh my God, why is Andrea Coyle going over into the psych building? Because that's where it was housed. So we need to remove this. We need to have these conversations. So again, Shifties, Bob and I, if you're interested, you want to have us come speak to any groups, we are all for it. Bob, do you want to tell the Shifties a little bit more about what people say to you after they hear your story?
Yeah, that's and each one of them's a little bit different. And going back to that Pathway conference, there's a couple of connections there. The ANCC and the Pathway to Excellence, they've created a well-being credential. You talk about EAP. There are, suicide prevention professional associations that people can connect with, and suicide walks and others that raise awareness around suicidality or suicide prevention and a lot of those kinds of things. I think there's, creating that sort of sense of belonging within an organization and creating, again, that sort of space. For that particular session at the Pathway Conference, it was a full room. There was a nurse practitioner that came up during the Q&A session, and he made a comment at the session that he is a 4-time suicide attempt survivor, and because of and it was a short period of time, right? It was it was during a concurrent session at the Magnet and Pathway Conference, but we created that sort of safe space even in that particular room in a short period of time. And he asked how many other nurses that were in that room are suicide attempt survivors, and the number of hands that went up was it was hard, to see that many people, and those are the people who had attempted suicide and survived. The emotions that people came up afterwards and talking through some of their own struggles and having that level of conversation, that whether they've been able to get help or not. And we know that there's opportunities within, our country, the United States, much less around internationally, for improved behavioral health services and therapy and support and having those resources available to many more people.
Bob, in your journey, have you read about, have you learned that perhaps suicide is more prevalent in the profession of nursing? And do you know any statistics on that? Have you read anything that you could share with the Shifties?
Yeah, I did. There was a study that was published, I believe, in 2019, and in there, from what I recall, and I'd have to go back and take a look at the actual article, but it was over 700 nurses had completed suicide in that particular in that time frame there in that publication. And we continue to see even currently that the suicide rate among nurses and healthcare workers are 2 to 3 times higher than the general population. I think it's 26 per thousand or 100,000 in there, but so you can take a look at that. But so it is higher, and so and part of that is due to the stress of the work that we do, the care of the when we think about the care of the patients that that we're managing on a regular basis. The increase in workplace violence that we see across the country and the stresses that are associated with that, long hours, their staffing has been named as a part of those that we deal with on a regular basis. I think there's a couple of components there, even as a nurse leader in what we have to do. To be able to manage every parts of the organization. We have every part of the balanced scorecard, if you're going to look at it from a nurse leader, and our responsibilities and how much pressure is placed on those leaders, frontline to chief nurse and others in there. It's pretty incredible.
It is really incredible. And I just want to thank you, Bob, for sharing your knowledge and sharing your journey. And I think we have so much work to be, and I think I'm speaking for myself, but I'm sure many nurses, we have a hard time setting boundaries. And what I mean by that, and I did this when I was an ICU nurse, it's empathy fatigue. We have so much empathy that it's exhausting. And I remember taking care of a 38-year-old woman in the ICU that was the mother of 2 children, and her husband was with her and she was dying from cancer. And her husband actually had to console me, which I just had so much empathy, and it's just so the whole thing just consumed me. And my whole drive home, I cried. And I think that's what makes it so difficult for nurses is in that clinical care delivery environment, we take on a lot of that empathy. As nurse leaders, we have to guide and direct and support the people taking care of the people that are feeling all that empathy. And in my career, I've had two nurses that I've known that have committed suicide. So it's real. And I think this discussion and this topic is really important. And I'd love for you to come back. Bob, would you come back in another session and speak to the shifties again?
Absolutely. Yeah, there's so much more we can talk about. And I shared a little bit in the even in the pathway, just this race to nowhere concept. So in there, it's the constant pursuit of excellence at the expense of your own mental health and well-being, and never feeling like you're good enough. And so, how much, never being able to stay present. You achieve something, and then you got to, it's what's next in there, and that could be from education to certifications to awards and recognitions and all of those things. And so, you talk about setting those boundaries. I think being able to say no, we don't. It's hard to say no. You take on more,
Right.
and so lots to talk about there as well.
I know I love that topic because I'm guilty. I literally woke up this morning at 5:15. I'm an early bird, and I started thinking, okay, what's next? What can I do next? And it's just that constant pursuit. What did you call it? The constant pursuit of excellence, or
Yes, yeah,
and it's exhausting. And then we fail to take care of ourselves. So back to my example, I had two small children. I was working my master's degree. I was a night shift nurse. I was a wife. I was a friend, and I lost sight of giving myself any time. And I exhausted myself to the point where I ended up at EAP and was really just in a bad place mentally. It was a rough journey. And I remember feeling like I'm not sure if I can keep doing this. And then I started thinking, what if I thought about hurting myself? I never actively did it, but I started having that thought, like, what if I could do that to myself? And that's when I really knew that I had to get some help. And that was kind of my shift. So Bob, typically at the end of our episode, we give a couple nuggets or a couple takeaways that we hope will help change the minds, help shift, not change, help shift our shifties and how they think about things. So what's one or two that you want to share with the shifties?
that's a good question. I think, one, and I think going back to name it, name it,
Claim it, tame it.
claim it, and tame it.
Yep.
Yeah. So that's a big one. So naming it, and so being able to say, "Hey, it's okay to not be okay," and to then to be able to receive the help that you need, and so you can begin to name it and claim it from that standpoint. The tame it aspect in mental health, I think, can be a little bit harder, and I don't think I've tamed it yet. I'm working through all of that. And I think the second part of that is around self-care. You mentioned that early on, but really looking at self-care, there are 6 domains of self-care that I have embraced a lot more, and how do I take that time, for myself and have self-compassion and care as a part of my journey that's been helpful. And the other is give people some grace and benefit of the doubt. Understand their lived experiences. You may not understand it, but recognize that everybody has different lived experiences, whether it's our patients, people in the community, the people we work with on a day-to-day basis, and realize that they may be going through something. And if you've developed a good enough rapport and relationship with them to ask, because you may have been the person that's going to help them through that. And so but maybe that's more than 2, maybe that's 3. I could probably give more, but those are some big ones there.
No, those are perfect. Those are so well said. And name it, claim it, tame it. I like that you said you're still taming it, because I believe every day is a different day. And so every day you have to work on taming it. I will tell you, having these discussions and telling your story is a great way to tame it. So shifties, I want to reiterate one last time, myself and Bob, we are passionate about promoting nurse well-being. We are passionate to make sure that we can give you the tools to name it, claim it, and tame it. So again, if you're interested, please reach out to us. And shifties, I say this every time at the end of the podcast. Remember, your shift makes a difference. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.